How point-of-care ultrasound will change the future of healthcare. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content is not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it works for your local, unique situation. Course objectives. At the end of this section, the students will be able to verbalize why point-of-care ultrasound has so many benefits to the healthcare industry. They'll be able to verbalize the importance of point-of-care ultrasound for the future of healthcare quality. They'll be able to verbalize how ultrasounds will change the future of healthcare. This section is really important because we are implementing technology more and more every day into our healthcare service lines. The more we can utilize and improve outcomes, reduce the waiting game, the breakdown of communication between all the different departments, when we can do point-of-care ultrasound at the bedside as the care practitioner to get decisions quickly, management involved with a patient in a close, intimate environment, it makes outcomes so much better. It will greatly impact how we can refer people to specialists, to get them other ultrasounds in a timely manner, potential surgical needs. Based on your clinical setting and your service line, it could drastically improve the outcomes and the potential future of the patients we serve. You want to have confident diagnosis, quick management plans, and ultrasound is a great way with many of the symptoms and issues to be able to implement quickly versus waiting a few days for an ultrasound report to come. Additionally, point-of-care ultrasound helps greatly with staffing shortages. There are so many issues, especially post-COVID, with radiology departments being behind and patients being sent to the ER just so they can get ranked higher in an ultrasound urgency pool versus if you had an ultrasound machine in your clinic, your urgent care, even EMS is getting it more and more for their cardiac decision making and the viability of a pregnancy and management decision between the mom and the baby, and quick decisions in those urgent situations really is going to improve outcomes with point-of-care ultrasound. But it's important that we have the appropriate training, oversight, and governance in place to make sure that these machines and these technology tools are being implemented appropriately. So we want to talk extensively about the benefits. We've went into the high-level aspect. It is a non-invasive, there's not CAT scans, there's not contrast, there's no CTs. It's a simple machine you can grab down the hallway to get your information. Whether you're ruling out an aneurysm, you can use it for fractures, you can use it for fetal maternal well-being, you can use it for a gynecological procedure, you can use it for abdominal evaluation, you can use it for liver, bladder, heart, lungs, kidney, intestinal system. There's so much information that point-of-care ultrasounds based on the healthcare practitioner's decision-making, symptoms, treatment plan. Grab the machine, get some answers quickly, and move to the next stage of care expectations. You also need to know that there are risks. We have the thermal bioeffects and the inertia and the inertial cavitation that we may not know with babies and kids and long-term developmental challenges this may have. You need to really do a risk-benefit analysis and determine, is this the best utilization of this machine to implement, making sure cross-contamination, cleaning of the machine and the fluids that's being utilized so you do not cause more harm to the next patient using this machine because you didn't clean it well the first time. You want to make sure that we're looking at the importance of the future and trends. Point-of-care ultrasound is getting implemented more and more at the bedside for the resources. We're getting more and more of a globalized system where there's huge ultrasound departments, there's huge shortages of patients, there's more and more rural communities becoming one-stop shops in their urgent cares, their clinics, their outpatient centers to be able to do a lot of different things for these patients to take them to a tertiary center and the next level up and deviate them based on the results of those point-of-care ultrasounds. You're going to save lives, you're going to reduce utilization of unnecessary resources because you can focus your assessment and avoid labs and other testing because of your ultrasound findings you got at the bedside. There's so much with enhanced diagnostic capabilities as the machines get better and better and more portable. We were just talking with a sales rep a couple weeks ago about third world countries, and now as long as you have access to internet, these pads and these mobile ultrasound services that you just plug into your computer, your pad, there's an app, there's a program, you attach your transducer, and you have your own portable ultrasound machine wherever you go. They're getting more and more of mini computers for an affordable cost as time goes on. It's going to be more and more accessible to make decisions in these low resource centers based on these modifications and technology improvements with point of care ultrasound. We're going to improve efficiency. The images are going to be clear. It's going to be more user friendly. It's going to allow, there's going to be artificial intelligence being implemented in to help with encouraging and directing management. You're going to shorten hospital stays. We're going to have more outpatient facilities. We're going to lower healthcare costs and better utilize our resources available to us. Point of care ultrasounds expands access to care and breaks down barriers to people that can't go to multiple places and wait a few days for answers and can't go to the ER for everything because that's the only way to get an answer fast nowadays. You want to make sure that while we're implementing more and more point of care ultrasounds, people are getting the proper training, certifications, and resources to support it so we can continue those great outcomes. We don't need to be implementing a bunch of new technology that people are not utilizing and don't understand all of the tools and the capabilities with the machine, and then they're missing things because they can't optimize the images and they don't know exactly how to get the machine to do the things they need to do. So we want to use this also with facilitating telehealth. They're getting more and more point of care ultrasounds where you can do it virtually, remote, a distant service line, depending on your specialty. There are so many amazing things coming out with telemedicine and ultrasound point of care services. It gives us more opportunity to get back to that personalized medicine, the bedside care, the decisions being made between the healthcare practitioner, the nurse practitioners, the midwives, the PAs, and utilizing technology in the most appropriate way possible, artificial intelligent algorithms, documentation, image optimizations, subtle little abnormalities being able to be caught with those point of care ultrasound machines and updates. So as a summary, there's so many amazing things happening with point of care ultrasound across the country and around the world, improving access, affordability, education, resources, certifications to be able to implement these massive point of care ultrasound uses in emergency situations, EMS, ER, critical decision making, timing, because if we're not interpreting the images correctly, we're going to actually decrease our outcomes versus improving them by adding more and more point of care ultrasounds.